All right, ready to dive in. Today we're tackling infective endocarditis. And before you switch channels thinking medical jargon, trust me, this is about your heart and it's way more interesting than you'd think.
What's wild about infective endocarditis, or IE for short, is it's like a blast from the past, medically speaking. We're talking records from centuries ago, but like we'll get into modern life. It's thrown, i.e., some curveballs.
Okay, so heart health is the topic, but we're getting specific, right? I've been digging through research studies, old accounts, even notes from this cardiology seminar, and IE is all about infection, like bacteria setting up camp in your heart.
Exactly, and not just a random infection either. IE goes straight for your heart's inner lining, those crucial valves that keep blood flowing the right way. Your heart's a fine-tuned machine. Even a small hiccup throws everything off.
And from what I'm seeing, this isn't some rare thing either. The seminar emphasized how IE's become a global concern, been rising for decades now.
It's true. The numbers are startling. Between 1990 and 2019, IE cases more than doubled globally, and deaths from it almost tripled. Huge jump, and researchers are scrambling to figure out why.
Wow, that's alarming. So what's behind this surge in IE? Is it just us living longer, giving these bacteria more time to move in?
Living longer plays a part for sure. More wear and tear on our hearts as we age makes them vulnerable. But it's not the whole story. It's complex. Your age is just one piece of the puzzle.
Okay, so age is a risk factor. What about men versus women? The seminar mentioned IE affecting each sex differently, which I found interesting.
You're right, there are key distinctions. Men, they're more likely to get diagnosed with IE, but sadly, women face a higher chance of dying from it if they do get it.
Hold on, so same diagnosis, but a woman might be fighting a totally different battle than a man. That's huge. Something to discuss with your doctor.
Absolutely. It highlights the need for more research into what's different for men and women, both in terms of risk and how we treat IE. Shows how important personalized medicine is.
Makes total sense. Now, other risk factors. The seminar mentioned rheumatic heart disease being a major one, especially where healthcare access isn't great.
Right. Rheumatic heart disease is like a chain reaction, often starting from something you wouldn't expect, strep throat.
Wait, seriously? A sore throat turning into a heart problem?
It's those bacteria again. Untreated strep throat, which is a bacterial, can sometimes trigger a wonky immune response.
Mm.
Instead of just fighting the strep, your immune system attacks your heart valves too.
Whoa, your body's fighting itself, basically. And that can damage those heart valves, making them way more open to infections like IE down the line.
So strep throat, something everyone's had, can have these lasting consequences. Crazy. Shows how interconnected our bodies are and how important those preventative things are, like actually finishing your antibiotics.
Absolutely. Especially crucial where healthcare is limited.
Hmm.
Prevention, things like vaccines, early treatment, that can be life-saving.
It's true. Sometimes the best medicine is preventing the problem in the first place. But let's say someone asterisk is asterisk at risk. How does this bacterial invasion even work? They can't just waltz into our hearts, can they?
You'd think our hearts would be Fort Knox, right? But bacteria, they're sneaky, they've got tricks.
All right, I'm all ears. How do they pull it off? Think of it like this. Every day, just brushing your teeth, especially with gum disease or little medical procedures, bacteria can slip into our blood. Now, healthy person, no big deal. Immune system swoops in, neutralizes the threat.
Our bodies usually play good defense.
Exactly. But i.e., it flips the script. Damaged heart valve, any foreign material like a prosthetic valve, that's a weak point, an open door for those bacteria.
So they're just waiting for an opportunity.
Exactly. They find that vulnerable spot, latch on, and start building what's called a biofilm.
A biofilm, what is that?
Imagine this. Bacteria create this slimy shield around themselves, like a fortress made of, well, microbial goo. This biofilm hides them from your immune system. Camouflaged, basically. Makes them super hard to kill, even with antibiotics.
That is sneaky. So bacteria are holed up in their biofilm forts. How do doctors even diagnose this? It's not like they can peek into someone's heart and see a welcome mat.
Right? Not that easy. Diagnosing IE is like detective work. It's a broad spectrum condition, meaning the symptoms are all over the place.
So no flashing neon signs.
Not quite. Some people, they get the classic signs. Fever, fatigue, out of breath, maybe even night sweats. Others, though, might have zero symptoms early on. It can be sneaky, makes early diagnosis tough.
So symptoms are everywhere. How do doctors even start narrowing it down?
Connecting the dots, medical history, any risk factors, those symptoms we talked about, it all matters. The gold standard, the most reliable way to diagnose IE, that's an echocardiogram.
The echo, that's where they use sound waves to make pictures of your heart
Yeah,
rate.
exactly. Like sonar, but for your heart. With IE, doctors are looking for those bacterial fortresses, those biofilms. They call them vegetations in medical terms.
Vegetations, now that's an image. But seriously, what do these vegetations tell them?
They're vital clues. The size, where they are, that helps determine how bad the infection is, guides treatment. Bigger vegetation usually means a more serious infection.
So that's like finding the evidence, confirming it's IE. But what if the echo isn't clear? I read about blood cultures being another tool.
Crucial. Remember how bacteria sneak into the blood? A blood culture is like setting a trap. Take a blood sample, see if any bacteria grow, gives a good indication if it's IE or not.
Like having multiple clues,
Yeah.
just like a good detective.
Exactly. More pieces of the puzzle they have, the better prepared they are to fight it.
Which brings us to the big question. How do you fight something as serious as IE? Getting the sense this is no walk in the park.
You're not wrong, no walk in the park. More like, I don't know, climbing a mountain, fighting IE. But the good news is we've got some serious medical firepower to use.
Okay, no magic wand, but we're well equipped. Where do they even start? Sounds like attacking on multiple fronts.
100%, like a multi-pronged attack. And leading the charge. Antibiotics.
But we're not talking the pills you take for a cold. Oh, no. This is high-powered stuff, intravenous, often for weeks at a time. Intravenously for weeks? Man, that's intense, the medical equivalent of a long-haul flight. But that's what these bacteria need, huh?
You got it. But here's the thing. Even with that heavy-duty approach, sometimes surgery is necessary, especially if the infection's really messed up a heart valve. Surgeons might have to go in, repair it, maybe even replace the whole valve to get blood flowing right again.
Wow, surgery on top of fighting an infection. Intense. What determines if someone needs to go that route?
That's where those vegetations we talked about, they come back into play. Remember those bacterial clumps? Well, their size can actually predict how risky things are. Big ones, like over 10 millimeters, those can up the risk of serious problems, even a stroke.
Hold up, a stroke. With IE, this condition can really snowball, huh?
It can, unfortunately. Those bacterial clumps, they don't always just stay put on the valve. Sometimes pieces break off, travel through the blood. Now picture one of those lodging in an artery feeding your brain. That's when a stroke can happen. All about that blood flow.
Okay, now that's scary. Really highlights why catching and treating IE early is so important. The sooner the better to prevent those scarier problems down the line.
Couldn't agree more. Got to stay ahead of IE. So someone goes through all that, the antibiotics, maybe surgery, what happens, asterisk after asterisk. What's the long game look like for someone who's battled IE?
Right, because it's not like you just snap your fingers and everything's back to normal, is it?
Yeah.
What's the impact on their heart down the road?
Important question. And the good news is, with the right treatment, most people bounce back from IE. But, and this is key, it takes time. It's a marathon, not a sprint. And there's always a risk, even after treatment, of it coming back. Recurrence, we call it.
So even after beating it, a chance it could come back. That's got to weigh on someone's mind after everything they've gone through.
It does, and it highlights why they need to keep an eye on things even after that initial treatment. And even when they've recovered, IE can leave its mark. Some people have long-term effects that they need to manage.
So it's not just about finishing treatment, it's about the whole journey after. Now, we can't always control our health, but what about prevention? Can people do anything to protect themselves from ever having to deal with this in the first place?
This is the empowering part. You're right, we can't control everything, but we're not helpless against IE either. And the most powerful tool we have might surprise you. Good oral hygiene.
Wait, you're saying brushing my teeth can help prevent a heart infection? Seriously?
I know, sounds wild, right?
Yeah.
But remember those bacteria, how they get in through cuts, even tiny ones? Well, your mouth, it's a bacterial party, especially if your gums aren't healthy. So brushing, flossing, those dentist visits, they're not just for a pretty smile. They're your first line of defense, keeping those bacteria from getting a free ride into your bloodstream.
Wow, that's amazing. Who knew those lectures about brushing were secretly about heart health, too?
Yeah.
So good oral hygiene, check. Anything else people can do to stay ahead of IE?
Talking to your doctor, that's huge. If you're having any medical procedure, even something small, tell them if you've got any risk factors for IE. Past heart infection, valve problems, anything like that.
Knowledge is power, for sure. So arm yourself with information, talk to your doctor, and don't underestimate a good flossing session. We've covered a ton on IE from way back when to those cutting-edge treatments and preventing it, but there's one more piece to explore: artificial intelligence.
You're right, can't forget about the future of IE, and AI is definitely part of it.
Okay, so computers fighting bacteria now. This is getting good. The seminar I went to, it mentioned some really cool stuff about AI, like predicting who's at risk, even tailoring treatments.
Hmm.
Okay, so computers fighting bacteria now. This is getting good. The seminar I went to, it mentioned some really cool stuff about AI, like predicting who's at risk, even tailoring treatments.
Yeah, you're thinking in the right direction. Right now, they're looking at how AI could totally change how we deal with IE. Imagine AI that could look at mountains of data, your medical history, what your lifestyle's like, even your genes to figure out your own personal risk for ID.
So instead of those general risk factors, AI could be way more precise about who's going to get it.
Exactly. And early detection, that's just the start. AI could even help personalize treatments, making sure everyone gets the right meds, the right interventions at the right time. Could mean better outcomes, fewer complications.
Wow, so AI is your own personal health detective, always looking for clues and making a plan just for you. This is wild. What if your smartwatch could tell your doctor about an IE risk before you even felt sick?
Sounds crazy, right? But it's closer than you think. AI could really change healthcare as we know it. And with something complicated like IE, that personalized, proactive approach, that could be a game changer.
Okay, now I really feel like we've been to the future. But before we wrap up this IE deep dive, let's bring it back to everyone listening.
For sure. We've covered a lot today, from those ancient bacteria to all the new ways we fight them. But you know what they say? Knowledge without action. It's like a flashlight with dead batteries. It's about taking this info and actually using it to protect your own heart.
So what's the one thing you want listeners to take away from all this, the main point about IE?
This is it. You have more control over preventing IE than you might think. Simple things, keeping your mouth healthy, talking to your doctor, staying informed about your health, those make all the difference.
Remember, a healthy heart is like a well-maintained machine. A little prevention goes a long way. Take care of yourselves, and we'll catch you on our next deep dive.